Welcome to Cancer and Peace. My name is Sean Stewart. I'm the facilitator for today's discussion, and I'm here with Peter Scalzo, and we're on episode 4. I can't believe we're already here, episode 4, cruising along. And last time we had a discussion, we talked about the importance of spirituality in finding peace in your cancer journey. Mm-hmm. And it was a good discussion. You really laid out a bit of your 10-year journey from 2005 to 2015. Mm-hmm. Where you moved from having a medical solution to no medical solution in your cancer journey. And so in one sense, you had lost hope, and it seemed hopeless for a period of time. And then you described that moment where something changed in you and you started reaching out to a different area in your journey, and you found feelings of hope again, or feelings of the ability to move forward. Mm-hmm. And so we started just talking about this a bit. And we're now going to connect this with the grieving cycle. You know, where do you go when there is a trauma, a great loss, and how do you process it? And so today you're going to connect that grieving journey a bit with your cancer journey and give us a little bit more of your story.
Yeah, thanks, Sean. I appreciate that. And just to reiterate what had happened, it was on November 2nd, 2015, which was 10 years after my initial diagnosis and my 14th surgery. It was major surgery down in Manhattan, Lenox Hill, and it really represented a sea change. So just to give a big picture of that, the cancer, which always had a surgical solution, now became metastatic, invasive urothelial cancer, which I knew. In the hospital at that point, it had a 5% survival rate. And so I plummeted into new territory for me. And so I know there's models out there for the grief cycle, as it's called, and different ways of analyzing what happens when a person ends up in that grief cycle. For me, I'll just define my knowledge of it as you have that event. For instance, I had that event that happened, which was I am in a new place now with this cancer journey, and now it looks like the end of my life is near. And before, it was always kind of out in the distance, but this was something different. This was a new trauma to process. And if so, entering the grief cycle, usually the old models show a circle with 5 points around the circle, and a person gets into this grief cycle, this circle, and bouncing around, and the 5 points are denial, bargaining, fear, anger, and sadness. And the point is that that the person is actually experiencing those different emotions, and you know the caution was always, hey, don't get stuck in one of these places. And on the other side of it is acceptance, or the new normal. And so for 16 years, I've been running a cancer support group, and many times I've asked the cancer patients, what brings you peace? And every time I ask that question, the answer is acceptance. Acceptance equals peace. So what does it mean to go from trauma or the event to that place of acceptance?
So I'm going to ask the question. We've talked a bit, but the idea of acceptance opens a new reality is the idea in the grief cycle. So when you open the new reality, then you can live in that reality, which is a great thing. But what were you in denial of? I mean, I have my idea what I think you were in denial of, but what do you think you were in denial of as you started into this journey?
Yeah, I think for me, it was the denial of how bad the cancer actually was. I mean, I was dealing with a life-threatening high-grade urothelial cancer for 10 years and was always under the mindset that the doctors would have a resolution, the surgeries would come in and eradicate any cancer. And I had many surgeries. And then in 2015, leading up to it, I'll tell you just what was going on emotionally for me. I was scheduled to go on a trip to Spain to meet my wife and daughter there. And right before I was scheduled to go on that trip, my bowels shut down. And I knew something was going on inside my body because that was an abnormal thing to happen. I think for me, a lot of times I can tell when I'm having a cancer event recurrence because different things will go on in my body that don't normally happen. I've had a lot of work done on my intestines because they use intestinal tissue to create my urinary system. 3 times they had to do that. But my bowel just closed up. This was right before going to Spain. So I spent 7 nights and days in the hospital with an NG tube to quiet the system down, and hopefully the bowels would open up. And they eventually did. And I went on my trip to Spain, and that was about a 8 to 10 day trip. Came back, went to see my surgeon, my cancer surgeon, and he flushed some fluid through. And at first he didn't find cancer. Then he found cancer. He flushed fluid through my urinary system. And so that brought me into getting tested and doing all that stuff, which brought me into that surgery. But again, I thought, well, the PET scan didn't show much. The CAT scan, the MRIs, they just didn't show that much. So we're probably pretty good. Maybe he'll get in there, revise this urinary system again, and I'll be fine. Meanwhile, the day of the surgery, November 2nd, I was in a 10-hour ordeal. And of course, I was under anesthesia and didn't know it, but there were 3 surgeons, and I've described what happened. They had 50 years of experience, and they didn't know what to do because they found invasive urothelial cancer wrapped around my aorta, all through the ureters, all through the area there. So when I woke up from that, and my head surgeon was there, and I remember in that ICU room at night, and he met with me and said, "This is a completely different situation. The cancer was much worse than what we thought." And he started to go over options with me. I felt my body plummet. That's when I felt the sensations of, I'm going to die from this. So denial, denial was not part of it anymore. I had to face the reality that I was going to pass from this cancer.
So you had early on had an idea of cancer and the medical solution, and you had pursued that for a long period of time. You get to a point where you're told there is no medical solution that they know of, at least at this point in the journey. And that's that was like a trauma event itself,
Mm-hmm.
but it shoved you out of the other denial.
Mm-hmm.
And I'm guessing what you're going to tell us about is layers of denial that you found in your cancer journey as you've gone forward, because even now you and I talk about you're going to go in for your latest scans, and there's times when you still feel fear, one of the items.
Mm-hmm.
And I think what you find, at least from our conversations, is that there's layers of denial,
Mm-hmm.
and there's layers of fear, and there's layers of bargaining that you go through. And so that
and
was
also
the start.
sadness
And sadness,
and
yes.
anger. Yeah.
Yeah, definitely. You talk about all those
Yeah.
regularly in
Yeah.
your journey. And so maybe a little bit of why does it look that way? It's not just this perfect little go through 5 steps and you find this perfect place of freedom, I guess.
Yeah. In other words, it's messy.
It is messy. It looks like, yes.
Yeah. And I think one thing we say in recovery, which I think is incredibly healthy, and that is to reveal is to heal. And I think that was the whole point of my journey in the hospital with the journal. We've talked about that before, about our buddies setting down a brand new journal, unwritten journal on my chest. What does that have to do with getting through the grief cycle and dealing with death? And so that was the first time that I had actually looked at and felt and experienced in a deep way those tough emotions of fear, anger, sadness, bargaining, denial. And I think that that's when the reality of my situation hit me. And I got stuck in a couple of those places. I got stuck in fear, and I got stuck in sadness. And I didn't know it wasn't so much denial at that point or bargaining at that point, because in the past I had always said, well, Lord, I feel like I'm meant to be transparent about my journey, and I'm meant to live this. So, of course, you keep me alive, and I'll speak out on this journey.
That was
right?
one of your bargains.
Yeah. And the public presentation of my journey. I mean, when I wrote my book, for instance, I was at a gala. 3 people independently came up and said, "Can I read your book?" And in the back of my mind, I'm thinking, I don't have a book. I don't want a book. I don't have the energy for that. Then a pastor came up who I didn't know and said, "God told me to tell you to write a book." So, but the cancer journey is not something that I wanted to necessarily be transparent about. It's a very personal journey and very painful, but I knew that God and I had this deal. You're going to keep me alive, and I'm going to be transparent about this journey. And I still hadn't had. I mean, I'd run a cancer support group, but I hadn't spoken out about my cancer yet. It was 10 years later, and I said to God, I'm like, "Hey, what about our deal?" I shook my fist. I'm like, "We had a deal. I'm dying."
I loved the description of you not that it was, but the description of you shaking your fist at God and everybody else was you expressing real emotion.
Yeah.
I do want to throw something in here that I think is really important for you to hear. And that is, God told me to tell you that to give me every dollar you have. And so, because that's the bargain you need to make.
Yeah.
Discernment is part of this journey.
Yeah.
So,
yeah.
It's kind of funny because when you hear these things, it's really also trying to understand what really is from God and what's not.
Right.
And as you go through this journey, something I just wanted to highlight, and it fits in with my journey. And one of the reasons why I'm part of the podcast here is you and I have done recovery together. Mm-hmm. And I think it fits in with the grief cycle discussion this way, is that you described, or we've talked about layers, you described bouncing around through different emotions there. And when we do the recovery journey, we go through the 12 steps. Mm-hmm. And I've seen the occasion where somebody will go through and they'll do what we call a step study. They'll go through the 12 steps. They complete the work of like 4 books and the journals and the things that you would do with that. And they've done the 12 steps. And so are they at healing? And you and I both I heard you almost giggle there as you said, he was like, yeah, they're healed, right?
Yeah.
And what we find is that there's a layer that's been removed or a layer that's been processed or worked on. And then we do it again. Mm. And then we do it again. Mm-hmm. And we do it again. And it's not because, 12 steps is that you beat it into the ground. It's we recognize as we finish this, that there's so much more in this journey. And we were talking about this podcast and your life experience as trail markers, that you were going to drop trail markers in the way. It's not that your way is the way. It's not that that there's only one trail, but you've got to a place now here in 2023 where you've experienced real peace. Not perfect, not everything that you don't experience these other things. You still have all those bouncy pieces of grief that you go through today. I think is what you're communicating with us. Mm-hmm. And yet you're dropping trail markers of how you got to where you're at today and finding real peace, even in that storm that we're talking about. Mm-hmm. And so maybe go back a little bit now and just examine some of those trail markers. Again, some more related to, sadness and anger. That anger moment you described, I think those will be really good for people to hear and understand.
Yeah, I think, life is fluid. And I love what you said. One time of going through the 12 steps doesn't mean, okay, I'm all set now. I'm fixed. Now I'm going to experience all the bennies of having gone through that. And life is fluid and changes. And, it's true. My experience in the cancer journey is that the cancer journey is fluid. And, sometimes a cancer patient will get a diagnosis, get their surgery, maybe radiation, chemo, whatever, and that's it. They're done. But they've still experienced trauma and grief and what it's like to get the diagnosis, to be all of a sudden your identity changes to, hey, I'm a healthy person, now I'm a cancer patient. You become one of the millions of people that are dealing with this disease, which carries with it the stigma of pain, suffering, and death. And, that's just part and parcel of it. And I think that that for me, as a Christ follower, for 10 years I had struggled through painful surgeries. I mean, these surgeries, abdominal surgeries that require a month in the hospital and then months of healing. But nevertheless, I was still focused on they got all the cancer out. And but not dealing really with anger and fear yet. Some fear, like when I had a PET scan or a CAT scan, that kind of thing. But those tests didn't even really increase until after metastatic came. Then now I have tests all the time looking for cancer. And so I would say in the hospital at that time, the two, I would say, greatest emotions that I was avoiding was fear and anger. Sadness was definitely part of that whole process because I knew that that my life was going to end, and I had to deal with the sadness of leaving Earth and leaving my family, and my kids were going to grow up without their father, and I wouldn't watch them in key life events and everything, missing out kind of thing. But I think the anger was, I had heard so much, oh, God's going to take care of it, which I believe that. I believe intellectually that God will. That's where my faith has me and brings me. But at that point in the hospital, everything looked completely opposite from what my intellectual faith was saying. And so anger was, you let me down, and everyone around me let me down. And the fear was, I know what it's like to do an end of life process, and I'm scared. I don't want to do an end of life. I already felt so crummy as it is. And I think the reality is that we are wired with emotions. I mean, we can talk about the role of emotions. Emotionally healthy spirituality is one of our, key thoughts that we do. But that was the first time that I actually had to process those emotions without the hope of, oh, the doctor's going to fix this.
I want to touch on a few things because there were examples. I remember when you talked about the 2005 incident, you distinctly discussed a feeling of wanting to throw up, the bodily reaction.
Mm-hmm.
And yet at that point in time in your journey of recovery and healing, you were more of a stuffer still of your emotions.
Mm-hmm.
And so a thing that you may want to think about is today versus then.
Mm-hmm.
How do you think about responding to your body? Because I'm thinking about the grief cycle, and you talk about bouncing around. And so there's a circle, there's different stages you're going through. And then one of the things I know about you from our discussion is some days you will come into like meetings we're involved with, and you'll talk about, this week I feel sadness and I'm struggling with sadness, or this week I'm struggling with anger and I'm wrestling with that. And this journey is not a snap of the fingers quick thing. I think there's probably a desire from everybody here, that's, for myself included, is when I deal with something hard, I want to move through quickly and move on. And I don't think that's the story of your life and journey. It's actually each week you actually have to feel those feelings, you experience those emotions, and then you process them. And so I'd love to hear a little bit about, okay, how do I process them? What does that look like for you? Because early on, you manned up and like, I'm going to push those feelings down. And then you got to a point where you're just like, it's too much.
Yeah. Overload. And I think big picture for me, Sean, has been the Serenity Prayer. And it's kind of the overarching picture. And, the first line says, God grant me the serenity to accept those things that I can't change. Talks about in the courage to change the things I can and the wisdom to know the difference. But in a cancer journey, cancer is a disease that you really don't have control over. And so God, grant me the serenity to accept the things that I can't change. I know that my higher power has a major role in the peace, in getting after peace, going to peace. The other line is living one day at a time, enjoying one moment at a time, accepting hardship as a pathway to peace. That's a tough line, accepting hardship as a pathway to peace, especially in the cancer struggle. But I love the wisdom of living one day at a time, to process emotions, to be intentional and incremental. Don't try to bite off everything at first glance. I will tell you, though, in the hospital, when I had to process those tough emotions, there was no way out. I was in a place of blackness, and when our friend texted me, "How are you doing?" and I said, "It's dark and getting darker," that was a realistic portrayal of what was going on. I had no answers. I didn't know how to get out. So when he dropped that journal on my chest, the first thing I did was to write down my facts, my truths. What were my truths? And it was pretty simple. My body is broken. My body is lying here right now, and I don't know where God is. So I just wrote that out, the raw emotions. I am so angry at God, yet God, you are my higher power. I don't know where else to turn. I don't have any other place to turn. The doctors did what they could do. I'm in one of the best hospitals in the nation, and they're saying we're done. What am I supposed to do? And so it was to recognize the reality of my situation, not to sugarcoat it, not to deny it or bargain it away, but just to say, here's where I find myself. And to express, God, I'm scared. I'm scared for my children. I'm scared for me. I'm scared for what's happening. And God, I am so sad. Even though I was angry, I never, it's almost like a Job thing where I had a discussion with God that was a tough discussion, very tough. But I never felt, this is my one thing, I never felt like he was disappointed with me. I never felt like he was condemning, he was angry at all with me. I felt like, the picture I had is of us sitting at a table and we're just talking back and forth. And I'm like,
shaking your fist every now and then.
Yeah, I'm like, where were you? Where are you? What's going on here? What's happening? I've lived my life with my higher power, my belief in my higher power. I've served in the church. I've done all this stuff, and this is the end. That's how I felt. And so, but I had to face the reality and journal it. I had to write it down. Once I wrote it down, it's like, okay, that feeling is memorialized. Here it is. And I could read it back and say, yep, that's where I'm at.
So a trail marker to drop that for you was to express it, put it on paper,
yes,
get real about it,
yes,
and memorialize it.
Correct.
That's
memorialize
a trail marker.
it.
That's such an important part of
Yep.
emotional health, is to be able to move into that space where you will actually put it on paper and process it and allow it to be what it is.
Yes.
It's a great trail marker, because I think that's something we see in recovery that works. We do inventories with journals and write down what's the person, place, or thing, what's the event, what's happened here.
Right.
Is a great starting point for finding healing. And you can't find healing without the recognition of what's actually happened.
Yeah, I think to reveal is to heal. I think we have to feel is to heal. I had to, at that point, express that. And I'm sorry for people who are in that situation for whatever reason, their theology, their personality, whatever, that they feel like they can't be honest about those emotions and memorialize it, like they're somehow going to be viewed as weak or a failure or whatever. I'm sorry for that, for folks who are in that place. In fact, this past weekend we had a cancer support group, and one of our ladies with a tough cancer she's a mom and a wife, she had not wanted to express any fear to anyone because she didn't want it to impact her family. So she got a therapist, and she told that third party everything, and it was a breakthrough for her. I could tell just on our Zoom call. I'm like, this is a breakthrough for you, because she was able to express what was going on inside of her, you know?
I've heard that story a lot. What you're like the position of showing strength on the outside, and I think this is now opinion, I guess, but that's probably not a great approach for finding healing, is to put on a position of strength. That doesn't. There's from our recovery journeys, we know that you need to get to powerlessness.
Yeah.
And sharing powerlessness is a great gift. And you can comment on it if you like. I want to talk about something that sticks out as part of the benefit of acceptance on your journey. That to me, it sticks out. And that was one of the responses that most of us never do with our kids, was you going out and recording messages to all your kids. You took time to say, hey, what's really important now? And because you moved out of denial of your mortality, or that you were mortal, that you were going to, die at some point, and it seemed now sooner than later by everything you're being told, it forced you into a place of accepting this reality. And then you didn't just sit in it, you worked through that, and then you decided to act on it. It opened something new up. I'd like to talk about that too a little bit, because to me that was such a great expression on your part for your kids, and you put it onto YouTube for them, and it's there forever. And it's something that most of us never do.
Right. Yeah. And I used recovery. I used Serenity Prayer and other recovery concepts to leave trail markers, really, YouTube, of how I process difficult and traumatic situations. And for me, the cancer journey, I wanted them to have something to memorialize, how did Dad process this difficult journey? My kids at that point, I mean, my youngest is 19. She's almost, she's only known me as a cancer patient, my youngest, because I'm going into my 18th year pretty soon. So, but the other kids were older, and my oldest will be is 34, but they were in the hospital with me in 2015 and after. I only a few times. I have some. I spent actually probably 10 days, but almost all my hospital stays, one of my children has been with me in the room 24/7. And my daughter was there in 2017 when the doctor and the oncologist and the fellow came in with tears in their eyes and saying, "That's it, we're done." So she had to process her dad getting an end of life, another go home call, hospice, go on disability. So I have not sugarcoated my my health journey with my children. I believe, though, that they've seen an honest. I've been transparent, vulnerable, and honest with them through this journey. But they've seen me struggle. But they've also seen me, because when I communicated that what was going on in my cancer journey, I already had that pivotal journey into acceptance. And even though I was bouncing around again within the grief cycle, again, the sea change in 2015 had such an impact on me that I was able to present sort of what we call non-anxious presence with my kids. Most of the time, that's how it's been.
Edwin Freeman, Failure of Nerve, talks about non-anxious presence. The greatest gift we can give to someone or in leadership is a non-anxious presence. And as a dad and in these ministry spaces, that's a huge concept. And it's worth, if you haven't read this work, it's a great work to read and understand. I think I'm going to summarize a little bit of what you've said and see if you like this. Is the trail marker looks like when you start this journey, you're going to feel a lot of deep emotions, and there are going to be anger, sadness. There's going to be fear. And as you go through that process, take time to pick up a journal, find a way to communicate with maybe in a cancer support group, people that are close to you that care about you.
Mm-hmm.
But start with the truth. What's the truth about your situation? Maybe it's even about your mortality or about, what loss would look like. And starting to communicate the truth about those things is the initial stages to working towards peace, because you have to work through each one of those. And as you feel it, reveal it, document it, share it, expose it, wrestle with it, and start letting go of those things to God.
Yeah. So I think, I don't know if we're winding up this episode, but to just sort of complete, because I think it should be said, going through the grief cycle for me and where I was at and writing down the reality of my situation, set me up for the unbelievable benefit of spirituality within my journey, of the fact that there's this higher power and there were all these truths that I believed in from this higher power, and I grabbed onto those truths, felt his presence, and that was amazing. And
his
it's
presence,
something we should talk about. Yeah.
His presence is what brought peace.
Yeah, amazing.
Yeah, and I think that's the last episode you talked about, actually feeling his embrace there in the hospital. And I think we're going to start at some point, we're going to reveal a little bit of that story from 2015 to the present. Yeah. Because how is it that you're still sitting here today after being sent home a couple of times? And even, what happened last week, I'm going to be interested, because every week there's something new in the journey you're having. It's not as if there's not a new poke and prod and question about the cancer journey or what it means in your life. Every week you have to, embrace this reality, live in it, and do the medical steps as well as the emotional and spiritual connection to that, grieve that reality.
They've
every week
written letters to my, insurance carriers, all that I'm a terminal cancer patient. And with that, I was speaking with my oncologist a while ago. I said, when do we stop doing treatment? Is there a time? And she said, no, because all our data suggests that if I stop treatment on you, then the cancer comes right back. And her longest running immunotherapy patient is 2 years. I'm going into my 7th year of immunotherapy. The doctors we're in uncharted territory. So you're right. Every week, every day, I deal with that fact.
And that fact is something about the unknown future.
Yes.
Like, how long could this go?
Absolutely.
This just such an unknown.
And we'll talk about that. Like what is a healthy perspective when you're dealing with a terminal, cancer diagnosis.
I also don't want us to minimize someone who doesn't have a terminal cancer.
Right.
But you talked about the identity change.
Yeah.
As becoming a cancer patient. In our second episode, you highlighted that as like the moment you get this diagnosis, something you have to grieve is that your identity has changed. You're not a cancer patient. And I do think anyone who hears this, there's at least a layer of their mortality, getting in touch with their mortality that happens with this. And it may not be your 2015 experience, but certainly a layer of, you talked about yourself, I'm not ready to die.
Yeah.
You weren't given a death sentence at that point in time, but you certainly got in touch with a layer of your mortality on that initial diagnosis.
One of my buddies a couple years ago, he'd go around, I can die, I'm all set, and he had this like little nodule on his kidney, which turned out not to be anything, and he was undone for the week. Right. Undone.
He was brought in touch with his mortality.
Yes.
And that's the piece we're talking about of the moving into a reality of what we believe about what is a lot of what your journey is about.
And then, what's your worldview? What's my worldview about existence after life, after this life? It has a great impact on it.
So for today's episode, I think we're going to stop here because I think we've left a trail marker, and the trail marker looks a lot like, learning how to connect with those deep feelings and understanding what
Yes.
you're in denial about, and then taking time to really start to process. And once
Right.
you starting to process, that was your experience.
Yeah.
Opportunities for God to enter into that pain and suffering and bring peace came on the backside of that. And we'll talk a lot more about that journey. But if you're interested to learn more, go to cancerandpeace.com. Peter has his book and many other resources out there. And we're going to be back with future episodes talking about this journey and how do you find peace in a cancer journey.
Yeah. Amen.
Thanks, everyone.